Today is February 19th, 2022. My name is Gabriela Estevan, and this is my case presentation on cystic fibrosis. This is a typical patient presentation. A 2-year-old Caucasian male born outside of the U.S. comes into the emergency room presenting with tachypnea, wheezing, and persistent coughing. While asking for his history, his parents report 2 past cases of pneumonia. Upon testing, his stool comes out bulky and greasy, while bacterial cultures of his sputum come back positive. Now for the etiology or the underlying cause of cystic fibrosis. This disease is an autosomal recessive disease, therefore meaning that it is genetic. Cystic fibrosis is caused by the mutation of the cystic fibrosis transmembrane conductance regulator gene, or the CFTR gene. This is found on chromosome 7. There are thousands of mutations which could potentially cause cystic fibrosis, but the most common mutation is delta F508. Which is essentially the deletion of 3 DNA bases for the 508th amino acid. As we know, genes encode for functioning proteins, therefore a mutation of gene will lead to a malfunctioning protein. And in this case, the mutation in the CFTR gene will lead to a malfunctioning CFTR protein. This protein is essentially a chloride channel found on epithelial cells of sweat glands, airways, also found on the pancreas as well as in the intestines. Cystic fibrosis can be categorized into 6 classes, each describing the severity of the mutation of the CFTR gene. Class 1 would be considered the most severe, whereas Class 6 would be considered less severe. Here we can see a better description of the 6 different classes that were mentioned in the previous slide. Here in Class 1, on the left-hand side, all the way at the top, we can see that the protein was not synthesized, therefore it will not be found on the plasma membrane. In Class 2, there's an immature form of the protein created, meaning a protein technically was synthesized, but since it was an immature form, it was degraded before it was able to reach the plasma membrane. In Class 3, we can see that there is, in fact, a protein on the plasma membrane. Here we can see it present, but its activation is disrupted, therefore meaning that it is not functioning. In classes 4, 5, and 6, we can also again see a protein on the plasma membrane. Despite its presence, its function is most likely reduced or partially defective. Cystic fibrosis mainly affects the white population. About 1 in 29 Caucasians in the United States carry the CF gene. The median age of survival in the United States for females is about 37 years, whereas males live up to about 40 years. Between the years of 2000 and 2010, there has seemed to be a 1.8% decrease in mortality rates for patients with cystic fibrosis. Approximately 1,000 new cases of cystic fibrosis are discovered every year. The median age of diagnosis is around 6 months. This is most likely due to the newborn screening for cystic fibrosis, where all newborn babies are screened for CF in all 50 states. Again, CF is an autosomal recessive disease, meaning there must be 2 copies of the mutated gene in order for the disease to be activated. The only way for one to develop cystic fibrosis is if both parents are carriers of the gene. This is the pedigree chart for cystic fibrosis. Here we see 2 carriers of the mutated gene. We see Harold and we see Charles. Since CF is an autosomal recessive disease, there needs to be 2 copies of the mutated gene, one from mom and one from dad, which is exactly what's given here. Since Charles had children with someone who was also a carrier of the mutated gene, 2 of their children developed cystic fibrosis. Harold is also a carrier of the disease, just as Charles, and yet his daughters do not have CF. This is due to the fact that he had children with someone without the mutation. This led to 2 healthy girls. Only one of them inherited the mutated copy of the disease, which essentially means that if at some point she marries someone who is also a carrier of the mutation, their children will also present with cystic fibrosis. Here we simply have an overview of what was talked about in the previous slide with the pedigree chart. Again, cystic fibrosis is an autosomal recessive disease, meaning you need 2 copies of the mutated genes in order to have the disease. Again, both parents must have mutations. The parents could be carriers of the disease, meaning they could be living perfectly healthy, normal lives without the mutation ever being a problem. As we saw in the previous slide, Charlotte and Matthew were both affected with the disease since both of their parents were carriers of the mutated genes. Now we can dive into the pathophysiology of cystic fibrosis. So the cystic fibrosis transmembrane receptor protein, or the CFTR protein, is responsible for chloride and sodium movement through cell membranes, meaning sodium and chloride coming into the cell as well as it coming out of the cell. A mutated CFTR gene leads to a malfunctioning protein. This malfunctioning CFTR protein then thickens what is supposed to be thin liquids such as mucus or sweat or secretions in the digestive system. Due to these thickened liquids, the affected organs would be the lungs, the pancreas, and the intestines, for example. So now let's dive into how CF would affect the respiratory system. So now, due to the fact that the CFTR protein is malfunctioning, therefore it's not really working, we would see an accumulation of mucus in airway tracts. This is mainly due to the fact that the ions that would usually reduce the thickness of these secretions is not active, it's not working. This then allows the secretions to remain thick and build up. The cilia then that is found in our lungs is unable to remove the mucus from our tracts. It has a harder time doing so due to the thickness of the mucus. Therefore, you get that buildup of mucus that then plugs one's airways. This accumulation of mucus then makes one way more susceptible to infections as well as inflammation. A main pathogen that usually causes infection and is the most common seen in cystic fibrosis patients is Pseudomonas aeruginosa. This is again the most common. It is very, very difficult to eliminate. It quickly deteriorates lung function, which this then leads to respiratory failure, which then causes death. Here we see a more descriptive effect of the CFTR gene malfunction on the respiratory system, very similar to what was talked about in the previous slide. Here we can see what the CFTR gene defect causes, which is reduced quantity or function of the protein, as we've talked about. This then leads to a defective ion transport, which leads to a depletion in the airway surface, which can cause mucus obstruction, infection, or inflammation. And all of these could potentially lead to end-stage lung disease. Cystic fibrosis can also cause issues in the digestive system, mainly affecting one's pancreas. The pancreas essentially secretes substances that help regulate digestion as well as blood sugar. In patients with cystic fibrosis, these secretions become a lot thicker, which then clog the ducts in the pancreas. Due to this blockage, the digestive enzymes are unable then to do their job, which leads to the malabsorption of essential nutrients. This may lead to problems such as stunted growth, diabetes, liver disease, and chronic or recurrent pancreatitis. These are just some of the symptoms that a patient with cystic fibrosis might present with. Again, it entirely depends on one's own body and the degree of protein malfunction. In the respiratory system, we see that excess mucus production as well as the coughing and wheezing is most likely due to the cilia being unable to remove the thickened mucus, therefore obstructing one's airway. Moving on to the digestive system, a patient could develop diabetes due to cystic fibrosis. As mentioned in the previous slide, a major organ that is affected is one's pancreas. This organ is in charge of maintaining blood glucose levels, therefore damage could potentially lead to a disruption of beta and alpha cells found in the pancreas, both of which are responsible for producing insulin and glucagon. A disruption to the pancreas will therefore lead to malfunction of the release of these two hormones, which ends in diabetes. In the reproductive system, many male patients with cystic fibrosis also develop congenital bilateral absence of the vas deferens. This prevents sperm to move from the testes to the urethra. This is all due to the same mutation to the CFTR gene. There are also some patients who have congenital bilateral absence of the vas deferens due to a mutated CFTR gene and yet not present with cystic fibrosis. In females, there is also a chance of congenital absence of the uterus and vagina, therefore causing them to also be infertile. One of the ways that patients are tested for cystic fibrosis is through genetic testing. Through this test, they are essentially looking for the 23 most common mutations that cause cystic fibrosis. As previously mentioned towards the beginning of the presentation, there are thousands of mutations that could potentially cause cystic fibrosis. Through this genetic testing, they are testing for the 23 most common mutations. Through sweat chloride testing, essentially they collect a patient's sweat and determine the chloride concentration. High concentrations of chloride are found in patients with cystic fibrosis. Normal levels would be about less than 29 millimoles per liter, whereas abnormal levels would be 60 millimoles or greater. Now for the treatment for cystic fibrosis. Through pulmonary therapy, bronchodilators help relax muscles in the lungs in order to improve airflow. There is airway clearance therapy, where patients simply inhale drugs in order to loosen and liquefy the mucus found in their lungs. CFTR modulators are recently new drugs, and these help improve the function of the defective CFTR protein. This is going to depend on how severe the defective protein is. There are also antibiotics that can be used to help with the many infections that are caused by cystic fibrosis, as well as lung transplants in the absolute most severe of cases. That is a wrap on my case presentation on cystic fibrosis. I hope you enjoyed.